Hello students. So today my topic is jaw relation. Jaw relation is a very important step in fabrication of complete dentures. So why do we do jaw relation? Jaw relation, it's the any relationship of the mandible to the maxilla that is called a jaw relation. That's the definition. So we're fabricating the dentures between the two bones. So that should be in harmony with the temporomandibular joint. That is a joint between the two bones. And if we are fabricating, we are constructing in the dentures, which is not in harmony with the mandibular musculatures, the mandibular movements, and the temporomandibular joint, then there will be severe discomfort. So to avoid this, we do the jaw relations so that the dentures which are fabricated, they are within the extensibility of the movements permissible by the temporomandibular joints. So this is a clinical step. Jaw relation is a clinical procedure. And the prior procedure which we perform in the patient's mouth is the border molding and the making the final impressions. And after making the final impressions, we make the final cast, secondary cast, and on that cast, on the final cast, we make the record bases, and on that we prepare the occlusal rims. So those occlusal rims will help us to record the jaw relations. So what we'll do in the patient mouth with the occlusal rims, first we'll do the customization of the occlusal rims. So what are the procedures we carry out during the jaw relation appointment? First, we establish the label form of the rims. So we'll check the label form of the rim. We'll check the occlusal plane, establish the vertical jaw relation, establish and record the centric jaw relation, then face the trunk and selection of artificial teeth. So how we will check the record base stability and retention? Record bases are required for making record and phonetic test. We will ensure that the rims are well adapted. We'll try to rock the dentures and see their proper stability. We'll check the proper stability of the record bases, and by placing alternate finger pressure on both the sides of each rim, and there should be no rocking, and there should be no looseness of the record bases. So we'll check for the stability and retention first. Then if it is slightly loose, then we will use a denture adhesive. The next step is, what are the causes of poor retention in record basis? It could be the dimension inaccuracy due to the polymerization shrinkage. It could be the over or under extension, like final impression is not made properly, or the bottom molding is not done properly, excessive blockout. So first we will make the label form of the occlusal rim. We'll establish the label form of the occlusal rim by checking the label fullness and the lip support. First foremost step in customization of occlusal rim is that. Why we are doing that? Because we need to establish the anterior posterior position of the anterior teeth and the proper aesthetics of the lips and the face. So what all guides we use? Facial aesthetics, phonetic guidelines, incisive papilla guidelines. So first, in checking the lip support, we need to see the facial aesthetics we are meeting the criteria of facial aesthetics or not. So by first we'll check the lip support. By facial aesthetics as a guide, what we will do, we'll check the fullness of the upper lip, we'll check the philtrum, and we'll check the nasolabial fold and commissures of the mouth. Like in this picture, you can see the lips are unstrained, lips are in a proper relaxed position. So if there is excessive wax on the labial surface of the denture, then you will see the lips will be constrained. Nasolabial angle is 90°, philtrum is depressed, and we can see the vermilion border. So in this picture, you can see we are meeting the criteria of facial aesthetics, proper lip support, where the denture is record base and the occlusal rims are providing proper lip support. See this in this picture, you can see inadequate lip support. So how we'll correct this? We'll add more wax on the labial surface and the labial contour to provide proper lip support. Inadequate or excessive, both kind of lip support can result in the can hamper the aesthetics of the denture. Next is the buccal support, buccal corridor. So buccal support, cheek support, and the buccal corridor. So that is also very important because we place the dent, we place the teeth in the neutral zone. So if there is the excessive buccal corridor, then there will be dark space, which will again affect the aesthetics of the denture. And if there is inadequate buccal corridor, then it can result in the cheek biting, like more of the if there's more of the wax on the buccal surface of the on the so it will hamper the cheek support, and then it can result in the so we will place the teeth also on that side or on that surface, so it will can result in cheek biting. So, though it is not as important as lip support, but then also you need to check this. Next step in customization of occlusal rim. After we have checked for the lip support, we have checked for the cheek support. Next is the establishing level and inclination of the occlusal plane. We need to establish occlusal plane using maxillary occlusal rim and using the mandibular occlusal rim. So, how we will establish the occlusal plane using maxillary occlusal rim? First, we will check for the anterior height and the inclination of upper occlusal rim. Incisal visibility, interpupillary line, and the posterior height and inclination of upper occlusal rim by the allotragus line and Stenson's chart. So, anterior height of the occlusal rim. First, we will check for the we'll adjust the anterior height of the occlusal rim. How we will do that? We will check the facial landmarks, like when the patient is talking and when the lips are at rest, how much how much the visibility of the occlusal rim is there. That will directly affect our incisal visibility. So, if the anterior height should be 1 to 2 mm below the lip at rest when the patient slightly smiles. So, and also like you can see in the picture, when the patient is in the rest position and he's slightly more, trying to talk and is slightly smiling, then you can see there is limited visibility of the this occlusal rim, that is only 1 to 2 mm anteriorly. And also you can ask the patient to do such movements like wetting of the lower lip line and the FOB sound, counting 50 to 60. Then also you can check the incisal visibility of the occlusal rim, that is should be 1 to 2 mm. Also, this incisal or tooth display or the wax rims display can also be adjusted. Like in this article, you can see according to the sex, age, and the length of the lip. Like in the females, it is more of the teeth are visibility is more, and in the males, the visibility is less. So accordingly, you can adjust the in the vertical anterior height of the occlusal rim. Like this in this article you can see, like if the lip length is 10 to 20 mm, then incisal display should be 3 to 4 mm. If lip length is more, then the incisal display is less. So accordingly you can adjust, and also in according to the sex and the age in and the age in young, you can see in young females you can see there is more visibility. So in this way we can adjust the anterior height of the occlusal rim. And also anterior height and the anterior plane of the occlusal rim is made parallel to the interpupillary line. How we will do that? We will use the Fox plane for that, and Fox plane is inserted into the patient mouth, and the this and we'll keep the scale parallel to the we'll keep the scale joining the center of the pupils, and joining the center of the pupil, we have kept the scale, and it should be parallel to the Fox plane, kept which is inserted into the patient mouth and kept in close contact with the maxillary occlusal rim. So in this way, we can correct the anterior plane of the occlusal rim. And anterior posterior orientation of the occlusal plane can be customized by making it parallel to the allotragus line. Xylotragus line, that is also known as Camper's line. Made this is the line made from the aloe of the nose to the tragus of the ear, and we'll mark this line. We'll mark this line on the patient's mouth by like we can take a thread and dip it into the plaster and make the lining onto the patient's mouth, and then we'll keep the fork spring in contact with the maxillary occlusal rim and check the anterior posterior orientation of the plane of the occlusal rim, whether they are parallel or not, and customize accordingly till they are parallel, like that. And also we can use the sensus duct, can also be used as a guide. The posterior occlusal plane is level at about 1/4 inch below sensus duct. So in this way, we have adjusted the maxillary occlusal rim. How did we adjust? First, we check for the label fullness, label tip support. We check for the cheek support. Then we adjusted the anterior height of the occlusal rim according to the visibility, according to the facial phonetics and the keeping the phonetics and the facial musculature as a guide. And next we corrected the anterior posterior plane of the occlusal rim, customized this according to the allotragus line. It should be parallel to the allotragus line, and anteriorly it should be parallel to the interpupillary line. After that, we'll once the occlusal height of the one of the occlusal rim is established, then the vertical height of the opposing rim is adjusted to provide an intraocclusal distance. That is the part of the vertical jaw relation. We'll discuss it. But how we will adjust the lower occlusal rim also, plane of the lower occlusal rim also we need to adjust before recording the vertical jaw relation. So first the anterior height and the posterior height. Anterior height should be at the level of the corner of the mouth. Should be so when the jaws are at rest and the lips are slightly parted, we should not it should just be at the level of the corner of the mouth, not be above or not below, like this. And also the mandibular occlusal rim adjustment, we posteriorly we can do it. The occlusal rim should intersect half to 2/3 of the retromolar pad. In this way we can adjust the posterior height of the occlusal rim. So in this manner we customize the maxillary and mandibular occlusal rim in the jaw relation procedure in the patient's mouth.